in first professional MBBS, usually questions from this topic usually will not be asked, but if you are growing well, questions from re-entry arrhythmia will be asked. So, I told you there will be 3 different segments in abnormal ECG which will be asked, right. One is acute coronary syndrome or myocardial infarction or ischemic heart disease. Second is heart block, and third is arrhythmia, that means rhythm disturbance. So, today I will talk about rhythm disturbance. Okay. So, rhythm disturbance, it is also called arrhythmia. Okay. Rhythm disturbance is also called arrhythmia, and particularly we will focus on re-entry arrhythmia which are occurring due to re-entry circuit within the myocardium. Okay. So, let us focus on what is re-entry. Okay. Let us focus on what is re-entry. So, amra re-entry ki jinishta let us understand, right. Okay. So, from the name suggests re-entry. Okay. So, it is again entering, right. Okay. So, you see this is normal myocardium, right. This is normal myocardium and this is abnormal myocardium, right. So, these are dead cells, these blackish colored cells are dead cells and these are normal cells, right. And in this picture A, here all the cells are normal, right, all the cells are normal. Now, you know, through the myocardium, small electrical impulses pass, right. We call it action potential, right. From one myocardium to another myocardium, the passage of small electrical impulse is called action potential, right. And you know, myocardium or cardiac muscle cells are specialized cells which has got a specific structure called gap junctions. Okay. So, gap junction is made up of protein, 3 protein contributed by one cell and another 3 protein contributed by another cell, and it constitutes a tunnel, right. And the protein is called connexin protein, right. Okay, this is called gap junction, and gap junction can pass voltage from one cell to the adjacent cell. So, if you depolarize one myocardial cell, it will depolarize all the myocardial cells adjacent to it, right. Okay. So, here, this is normal myocardium, and you know, action potential can pass in this direction and in this direction as well. Okay. So, it is bidirectional, but what happens due to some insult or due to some ischemic event, right, due to some ischemic event, few myocardial cells are damaged or dead, right. Few myocardial cells are damaged or dead. So, what will happen in this case? So, here is the dead cells, right. Okay. Now, the flow of action potential will be unidirectional. Okay. The flow of action potential will be unidirectional. Why? Because the action potential which is happening over here, it can impulse, it can you know, transmit sufficient current from normal area to the dead area, right. But in this segment only these few cells are working, so they will not be able to transmit action potential sufficiently from the diseased condition towards the normal condition, right, from the diseased part to the normal part. Clear? এখানে এতগুলো cell dead আছে, right. So, only these few cells, this 9 to 10 cells, they will be transmitting voltage over here, they will be transmitting electricity over here, right. So, it is a case of unidirectional block, but এখানে যেখানে normal cell গুলো আছে, normal cell গুলো অনেক আছে, say for example 25. Okay. So, all these 25 normal cells can transmit action potential here, but these few cells will not be able to depolarize all these normal cells. So, here is unidirectional block, right. If you face a question or short note like re-entry phenomenon, you need to explain this. Okay. So, for re-entry to happen, one must have condition is unidirectional block in action potential conduction, right.